Hi friends, welcome back to 1000 questions and answers series. First question, maxillary sinus opens, superior meatus, infundibulum, inferior meatus, none of the above. It's at infundibulum. Next question, access to airway is gained during emergency by endotracheal tube, emergency tracheostomy, cricothyroidectomy, all of this. And the answer is all of the above. Next question, which of the following structure is seen in oropharynx? Pharyngotympanic tube, fossa of Rosenmuller, palatine tonsil, pyriform fossa. And the answer is palatine tonsil. The present symptoms in majority of cases of acoustic neuroma are hearing loss, vertigo, signs of space occupying lesions, none of the above. It's hearing loss. Next question. The opening in case of dacrocrystorhinostoma is made in superior meatus, middle meatus, inferior meatus, none of the above. And the answer is middle meatus. Next question. The most common diagnosis in a young boy with history of profuse nasal bleeding is juvenile nasopharyngeal angiofibroma, nasal polyp, deviated nasal septum, cirrhosis. It's juvenile nasopharyngeal angiofibroma. Next question, ocular melanoma usually located in retina, uveal tract, macula, iris. It's in uveal tract. Next, presence of blood in anterior chamber of eye is termed as hyperemia, hyphemia, hemoconjunctiva, ectropion. It's hyphemia. What are the signs of corneal graft rejection? Redness, pain, decreased vision, all of the above. And the answer is all of the above. Next question, sensory neural hearing loss associated with the aging is called otosclerosis, presbyopia, Meniere's disease, presbycusis. It's presbycusis. Next question, which of the following is the accurate client education after meningotomy? Drink through a straw, wash face and ear frequently, avoid drinking through straw, none of the above. It's avoid drinking through straw. Next, pinkish discoloration of tympanic membrane in otosclerosis is termed as battle sign, Schwartz sign, auditory sign, none of the above. It's Schwartz sign. Classical signs of Meniere's disease are tinnitus, unilateral sensory neural loss, hearing loss, vertigo, all of the above. All of the above. Next question. The most common cause of impacted auditory canal. Cerumen, wax, foreign body, both A and B. Both A and B. Next question. Which of the following electrolyte imbalance expected for patient taking acetazolamide? Hypernatremia, hyponatremia, hyperkalemia, hypokalemia. It's hypokalemia. A gradual paleness blurring of central vision is the chief clinical manifestation of cataract, glaucoma, presbycusis, retinal detachment. It's cataract. Which of the following dietary restriction is given for patients with Meniere's disease? Fluid restriction, sodium restriction, protein restriction, both A and B. It's fluid and sodium restriction. Next, Lias sinus senin, Graves' disease, Meniere's disease, lateral sinus thrombosis, carotid body tumor. It's carotid body tumor. The incision used in endomeatal approach to the ear is Lombard 1 is incision, Rosen's incision, Lombard 2nd incision, Weil's incision. And the answer is Rosen's incision. Orbital apex syndrome involves olfactory nerve, ophthalmic division of trigeminal nerve, maxillary division of trigeminal nerve, mandibular division of trigeminal nerve. It's maxillary division of trigeminal nerve. All are true regarding mucocele of frontal sinus except cystic tender swelling, eggshell crackling can be elicited, displaces the eyeball downward and laterally. Treatment is front ethmoidectomy. It's cystic tender swelling. Brissac space is bounded below by fibers or lateral malleolar fold, Sharpnell's membrane, short process of malleus, neck of malleus. It's in short process of malleus. Pain in tonsillar fossa and upper neck is characteristic of Eagle syndrome, Uppert syndrome, Sickler syndrome, Usher's syndrome. It's Eagle syndrome. Myopia can be corrected with convex lens, concave lens, cylindrical lens, adjusted convex lens. Myopia can be corrected with concave lens. Next question. Emmetropic eye can be corrected with convex lens, concave lens, cylindrical lens, adjusted convex lens. Emmetropic eye can be corrected with adjusted convex lens. Which one of the following is not a risk factor of glaucoma? Diabetes, thyrotoxicosis, high BP, sinusitis. And the answer is sinusitis. Next question. The best visual acuity with the corrective lenses in the better eye of 20/200 or less is considered as normal vision, decreased vision, blurred vision, legally blind. It's legally blind. What is the earliest sign of cataract? Decreased color perception, diplopia, reduced visual acuity, absence of the red reflex. Decreased color perception. Next, which of the following is the site of epistaxis? Little's area, Woodruff's area, maxillary sinus, nasopharynx. The answer is Little's area. Woodruff's area തെറ്റാണ് കേട്ടോ. Little's area ആണ് correct answer. Okay. Next, which of the following is very vigilant to observe for a patient with a history of epistaxis? Running nose, redness around nose, coffee colored vomits, all of the above. It's coffee colored vomits. Next question. Noisy respiration produced by turbulent airflow through the narrowed air passage. Stridor, wheezing, crackling, rails. It's stridor. For a fresh tracheostomy patient, suctioning is needed at an interval of 15 minutes, 30 minutes, 1 hour, 2 hours. It's 30 minutes. Long-sightedness is otherwise called as hypermetropia, myopia, emetropia, astigmatism. It's hypermetropia. Next question. Which of the following clinical manifestations should the nurse associated with acute angle closure glaucoma? Sudden eye pain, acute light sensitivity, gradual loss of central vision, loss of color vision. It's sudden eye pain. When assessing an older client with a macular degeneration, the nurse should expect to find total blindness, loss of central vision, eye pain, loss of peripheral vision, loss of central vision. A repair of tympanic membrane is termed as ossiculoplasty, meningeoplasty, meningotomy, audiometry. And the answer is meningeoplasty. Next question. Severe hearing loss is observed in the decibel range of 41 to 55 decibel, 56 to 70 decibel, 71 to 91 decibel, more than 91 decibel. It's 71 to 91 decibel. Most common complaint of client with inner ear disorder: otorrhea, otalgia, tinnitus, headache. It's tinnitus. Next, post-operative therapeutic position after cataract surgery: flat position, prone position, sideline position, Fowler's position. It's Fowler's position. National Program for Control of Blindness launched in 1982, 1976, 1995, 1987. It's in 1976. Next, inflammation of cornea, conjunctivitis, keratitis, mastoiditis, laryngitis. It's keratitis. Next, common ear infection is wax, deafness, otitis media, blepharitis. And the answer is otitis media. Next question, incision of the eardrum is antral puncture, beringotomy, ear wash, rhinoplasty. And the answer is beringotomy. Next question, early symptoms of cancer of the vocal cord is sore throat, hoarseness of voice, swallowing difficulty, coughing. And the answer is hoarseness of voice. Swelling of the optic disc is termed as ptosis, papilledema, retinoblastoma, glaucoma. And the answer is papilledema. Next question, the chief clinical manifestation that may be expected in the early stage of cataract formation is eye pain, floating spot, blurred vision, diplopia. Blurred vision. Next question, the most common cause of epistaxis in the elderly is nasal allergy, hypertension, nose picking injury. It's due to hypertension. Next, an area of the retina which does not have rods and cones is yellow spot, red spot, blind spot, black spot. It's blind spot. The lens and cornea are not having blood supply, so the nutrients are supplied by choroid, blind spot, aqueous humor, iris. It is by aqueous humor, aqueous humor. Next question, damage to inner ear or sensory fiber that extending to cerebral cortex leads to nystagmus, sensory neural hearing loss, conductive hearing loss, otosclerosis. It's sensory neural hearing loss. And thank you to everyone.